Paramedic Care 3, Discussion 1. We're talking about a 57-year-old male who's complaining of chest pain. Patient reports a history of recent surgery that was performed to repair a fractured pelvis. Approximately 2 hours ago, he began to experience tightening in his chest discomfort, and shortness of breath. He now reports that he feels nauseated. So what would our initial assessment considerations with this patient? So we'd want to know information about the pain. What were you doing when it happened? Have you felt it before? Does anything help it get better or worse? When you're breathing in or out, does it change the pain at all? Where's the pain located exactly? Where does it go? Does it radiate anywhere? What type of pain is it? Short or is it sharp, dull, throbbing? And then on a pain scale 1 to 10, how bad is it? Does the patient feel short of breath? Do we see them coughing? Is there any kind of sputum involved? Do we hear any kind of audible rhonchi? The level of consciousness, is it different? Has it gotten better? Has it gotten worse? Does anybody there who's seen him? Are they sweating? Are they restless or anxiety? Do they have a feeling of impending doom? Are they fatigued? Do they have any kind of swelling or edema that we see? Do they have a headache involved with it? Have they passed out at all? Have they had any kind of behavioral changes? Was there any trauma that was involved? And then how big is the patient? Are they a healthy patient, or are they a large unhealthy patient? Your partner gives us some vitals. We have a non-specific wide complex tachycardia of an uncertain type. So before initiating drug therapy, what questions would you ask? Well, we'd want to know if the patient has any kind of allergies. Do they take any kind of medications? Are they currently taking them like they're supposed to? Do they take any over-the-counter drugs? And also, are they taking any recreational drugs? Things like that. Needing to know their allergies is a big thing. What's the most important step in the initial management of this patient? A big part of it is being able to identify when we're trying to manage this patient. Obviously, we can do our basic things. We want to know our ABCs and all that kind of stuff. But specifically with this patient at this time, being able to identify that wide complex tachycardia, if we can send that information into the hospital or something, we need to know what it is. Because if it's like SVT with aberrancy, or if it's VTAC, or depending upon what it is, changes how we treat it and the method by which we treat it. Then we're looking 5 minutes into the management of this patient. His blood pressure drops and he exhibits a decreased level of consciousness. What should you do next? Well, we're going to want to obviously start with supportive care, oxygen, different things like that, to make sure the airway stays clear, that it stays patent, and all those types of things. But we're going to want to reassess that rhythm. If it is in VTAC, or if he's got some kind of weird rhythm, it can only do that for so long and continue to stay healthy for so long. So we're going to want to see if it's gone into VFib or something else, to see if there's another treatment or a different avenue that we need to begin to look into to treat this patient.